Good evening. My name is Andrea Hartzell, and I work in the medical field. Today I will be discussing how STDs are contracted and how and why we should use protection. So, how would you like to tell your partner that you have a sexually transmitted disease? Would you tell your partner? Would you even know how long you've had it? I have a harder question than that. Would you like to be able to tell the father of your unborn child that you have a sexually transmitted disease and that the unborn child, even worse than that, may not survive the pregnancy? This does happen every day. And we all have to ask ourselves, do we ever want to be in this situation? Of course, no one does. People think they cannot get an STD. Well, we all can. We should protect ourselves, our loved ones, and our unborn children. According to the CDC, around the globe, there is 536 million people with genital herpes. 50 million of those people are in the U.S. These are some visual aids of genital herpes. There's 42 million out of those 50 million that do not even know that they have it. This is 1 out of 4 women. This is 1 out of 5 men. People even that are asymptomatic carriers can spread herpes. Does this make you feel uncomfortable? This should. This virus can also get transferred to your unborn child and cause severe health issues. You can use condoms to prevent this from happening. However, if you do have the virus, you can use an antiviral medications to keep from spreading the sexually transmitted disease. Well, do you think this is the worst? Because it's not. According to the CDC, gonorrhea is the second most commonly reported notable disease in the United States. This sexually transmitted disease can cause pelvic inflammatory disease. This is a woman's cervix during an exam of the infection of gonorrhea.
Oh.
This is a male, the tip of his penis, where gonorrhea infection has set in.
So would his penis just, would it just?
Yes, excrete the, that's
like,
infection.
that's how he'll know he'll have it, because it had like discharge or something out of it?
Yes.
Okay.
And for women, this can cause you to not bear children, cause ectopic pregnancies, and in addition, you can stay in severe pelvic pain. You all look like smart people. Would you rather use protection or have these long-lasting major issues? Nothing is worth that, and I don't think any of us want to go through that. And I would like to talk to you about the last thing that is a well-known and talked about sexually transmitted disease, which is HIV. According to the CDC, 1.1 million people in the United States alone have HIV. And this is just a number from 2015. How many do you think did not know they had HIV? 15% did not know. That is 1 out of 7 people. HIV will slowly affect your body systems. You will gradually start to experience anxiety and depression. You will begin to have seizures. Starting from the beginning, you will experience flu-like symptoms. As the disease progresses, you will get dementia, and in a later stage of the disease, you will develop lesions on your mouth and tongue with white film around them. There will also be inflammation on the tongue.
What is that?
This is a person with HIV.
Oh, okay.
With his mouth, and this is lesions on the actual tongue with the inflammation.
Oh.
There are many other things like your immune system continuously being under attack, respiratory issues, heart issues, and death. We can protect ourselves by not having unprotected sex. We can be aware by getting tested frequently. The amount of people that are unaware of being infected while still having sex, clearly unprotected, is scary. The numbers speak for itself. We are living in a time where there are most people unmarried, trying different things like dating websites and blind dates. Do you know who you're meeting? This could be one of us, one of your loved ones, one of your children, your unborn child. All of these diseases we discuss are horrible, with horrible outcomes, but how can you get epidemic numbers to decrease? We need to use proper protection while having any kind of sexual intercourse. If you use protection, you are eliminating the chance of getting infected with a sexually transmitted disease. Having unprotected sex is what makes you prone to contracting the disease. Latex condoms act as a barrier against the tiniest sexual transmitted disease pathogens. So my question to you, who is going to be tested frequently, and are we going to use protection? Thank you for your time.